My name is Dr. David Fouts. I'm the medical director at Progress West Emergency Department, and today we're going to talk about heroin. Heroin is an opioid narcotic similar to morphine. It can be injected, snorted, inhaled, swallowed. The initial euphoria that someone feels with heroin is called a rush or a high. That sensation is greatest when injected. Heroin causes excruciating abdominal pain due to constipation. When injected, it also causes skin infections, painful abscesses, scarring of veins, and it can even cause infections that cause heart damage. Injecting heroin even one time is especially dangerous because it causes tolerance and dependence. Tolerance is the need to use more drug in order to get the same effect. Dependence is the need to use the drug every day in order to prevent painful, excruciating withdrawal symptoms. The biggest risk with heroin is with overdose. Overdose kills 15,000 people every year. That's 42 people a day. If you include all forms of narcotic pain medication, including prescription pain medications, kills 60,000 people a year. It's 150 people a day. Heroin kills people by turning off the part of your brain which causes you to breathe. Initially, it just looks like someone is sleeping, but over time, breathing becomes more shallow. You become pale, white, your lips turn blue. Eventually, you start to shake, convulse, your heart stops, and you die. Obviously, not everyone wakes up in the morning, injects heroin, and overdoses. Typically, the path of addiction begins with seeing a doctor for a pain prescription from an acute injury or a chronic pain syndrome. The most common medications used are opioids like codeine or hydrocodone, also called Vicodin or Norco. We also use Percocet, also called oxycodone. These medications also cause tolerance, so over time you need more and more drug to get the same effect. Eventually, you get desperate and you end up turning to heroin. Oftentimes, leftover prescriptions are used by kids for fun on weekends, and this is how teenagers begin down the path of addiction. The best thing that you can do in an overdose is call 911. Paramedics, firemen, police, they all carry the life-saving drug called Narcan. Narcan reverses the effects of a heroin overdose. It's available without a prescription from a pharmacy, and some ambulance districts are even giving it away for free. It's easy to use. All you do is unwrap it, place it firmly in someone's nose, and push the plunger. It's safe. You can even use it on someone who is unconscious. The effects of Narcan work very quickly, but they also go away quickly. So after you would give it, call 911 and be ready to give a second dose. If you use heroin or if you know of anyone who uses heroin, get Narcan. It can really save their life. If you're addicted to heroin or addicted to multiple pain medications, get help. Go to the doctor, go to the emergency department, get online and find a Narcotics Anonymous meeting by going to stlna.org. That's stlna.org. Get help. There are resources available, and I know it's hard. There's painful withdrawal symptoms. It hurts, it's painful, I get it. But it'll be the best decision you ever make. So if you use heroin, or if you know someone who uses heroin, get Narcan. If you use multiple pain medications, just to be safe, get Narcan. If you are addicted, ask for help. It'll be the best decision you ever do.